1. Why do different species show varied sensitivity to toxicants? Different species have distinct anatomical, physiological, and biochemical traits that influence toxicity. For instance, rabbits can tolerate belladonna due to an esterase enzyme that hydrolyzes atropine. Horses and rats cannot vomit, making them more vulnerable to ingested toxins like red squill, used as a rodenticide. Ruminants can detoxify or activate compounds through microbial metabolism in their rumen, for example, detoxifying ochratoxin A or bioactivating nitrates to nitrites. How does the inability to vomit influence toxicant susceptibility in animals? Species like horses and rats lack a strong emetic reflex, increasing their risk when ingesting toxins. Red squill is toxic to rats but safe for most domestic species because of its emetic effect, which rats cannot respond to. Dogs and cats, capable of vomiting, often expel ingested poisons more effectively. 3. How do ruminal microorganisms affect toxicity in ruminants? Ruminants exhibit microbial detoxification or activation. For example, cyanogenic glycosides are hydrolyzed to toxic cyanide, bioactivation. Nitrates reduced to toxic nitrites. Ochratoxin A is hydrolyzed to non-toxic ochratoxin AHA. This microbial metabolism often determines whether exposure results in harm or protection. 4. What role does urinary pH play in renal clearance of toxicants? Urinary pH affects reabsorption of weak acids or bases. Acidic urine, e.g., in carnivores, favors reabsorption of acidic drugs like NSAIDs. Alkaline urine, e.g., in herbivores, promotes reabsorption of basic compounds like strychnine or caffeine. Thus, diet-related urine pH influences toxicant excretion and retention. 5. How does enzyme expression influence species' susceptibility to toxins? Species with lower levels of critical enzymes are more vulnerable. For instance, sheep have low glucose 6-phosphate dehydrogenase, G6-PDH, reducing glutathione regeneration, making them sensitive to oxidants like copper or nitrites. Cats lack UGT1A6, impairing glucuronidation of drugs like acetaminophen. Turkeys poorly detoxify aflatoxin B1 due to deficient glutathione S-transferase activity. 6. What are Phase 1 and Phase 2 biotransformation pathways? Phase 1. Functionalization reactions, oxidation, hydrolysis, by enzymes like cytochrome P450, e.g., CYP1A epoxidizing aflatoxin B1 to a reactive epoxide. Phase 2 conjugation reactions, e.g., with glucuronic acid or GSH, that render toxicants more water-soluble and usually less toxic, e.g., glutathione conjugation of aflatoxin B1 epoxide. 7. Why are horses more sensitive to monensin toxicity? Horses have low CYP3A expression and activity, limiting their ability to metabolize monensin. Consequently, their LD-succent for monensin is only 2 to 3 mg per kilogram, much lower than rats, 35 mg per kilogram, or chickens, 200 mg per kilogram, who metabolize it more effectively. 8. What genetic factors make cats and dogs more susceptible to some drugs? Cats lack UGT1A6 and NAT2 enzymes, limiting detoxification of phenols, acetaminophen, and sulfonamides. Dogs lack both NA1 and NA2, impairing acetylation, increasing risk of sulfonamide toxicity. These deficiencies lead to accumulation of toxic metabolites like hydroxylamines and nitroso compounds. 9. How does breed influence toxicant metabolism and sensitivity? Breed-specific enzyme polymorphisms affect metabolism. Greyhounds have low body fat and reduced CYP2B expression, making them more sensitive to lipophilic drugs like propofol. MDR1 mutation in collies impairs P-glycoprotein function, leading to increased CNS accumulation of ivermectin and opioids, causing neurotoxicity. 10. What is the function of P-glycoproteins in drug toxin protection? P-glycoproteins, PGPS, encoded by MDR1, ABCB1 gene, are efflux pumps in the brain, intestines, kidneys, and placenta. They prevent xenobiotic entry into the brain and aid excretion. MDR1 deficient dogs, e.g. collies, show exaggerated sensitivity to ivermectin, loperamide, and vincristine due to impaired PGP function.